Test, trace, and treat. It's the 3 T's and how San Diego plans to stop the spread of the coronavirus. Dr. John Bradley, Medical Director of Infectious Diseases at Rady Children's Hospital, talks about how it will work, what schools will look like in the coming months, and when we could possibly see some normalcy in our lives again. Dr. Bradley?
Yes.
I am waiting for some really good, every time I walk in here, I'm waiting for really good information,
Okay.
Positive information.
Okay.
What can you tell me?
I have positive information for you. And first of all, everyone's at the complete other side of the room, so that's why I'm not wearing my mask.
Yes.
And everyone who comes into this building is screened for fever, all the symptoms, so we're at low risk. Just want to get that on the table first, because I wear my mask out
Everywhere you
in
go.
public.
Yes.
Just like everyone else. The good news is that San Diego County is doing well with respect to getting this pandemic under control. And I want to remind you when it first started, and there were there's a case here and a case there. The county public health people were tracking those people down, looking at contacts, trying to isolate them. And then a few weeks later, there were so many cases, the county said, if you're sick, just go home. Just stay at home. You might have coronavirus, because it just outstripped the capacity of our system to do case investigation. Now, with announcement at San Diego Public Health and the supervisors, we are now moving back to a test, trace, and treat, the 3 T's, so that as we get this under control, we're going to locate everyone who's got infection and everyone around them, and we'll nip this in the bud. They're planning on hiring almost 500 tracers, contact tracers. So the good news is that we've gone from just a few cases to overwhelming our capacity to trace, back to we'll get this under control, we're going to trace it, we're going to track down every last case, and we will beat this. So the good news is that the county is able to now step up and beat this, so that we're all safe.
That makes me so happy to hear. We've been on this up and down over the past few weeks, and for some, we know that our county officials and doctors and so many people around the clock are trying to figure this out. So sometimes it's hard to be patient and to wait for information. And now we're at that point where people are starting to ask, well, what about me? And when can I go back to work? And,
yes.
and the kids in school. And the information is starting to come out now.
Yes. So everyone's planning for getting back. And as we chatted last week, I still believe that the schools are going to open, and the governor now is coming out with some plans on how schools will look different next year. But there will be some attendance at schools, so kids will be going. It's just, staggered shifts, more space between desks, that sort of thing. But don't worry, Shally, your kids will be back at school.
But not full time.
Probably not. I'm not in that planning process, and everyone wants to do the safe thing for kids. So if part-time is the safe compromise, that's what they'll do. But the goal, of course, is to get them back full-time, everything as close to what we used to have as possible.
We'll talk about school in a minute, but Dr. Bradley, on a time that we're heading right now straight into summer, and the behaviors of people are going to start to change, and people are going to want to start coming out of their homes again. During this time, I've had people message me and ask me, Shally, can you get coronavirus from the pool? And people want to start gathering with their little social bubbles and their family again. What do you think our life will look like, let's just say the next 4 to 5 weeks?
Okay, so great question. And there's 2 components to that. One is what's going on in the community. So San Diego Public Health, as those numbers go down, will feel a lot more comfortable going out. We all have masks, and in San Diego County as of Friday, if you're out and within 6 feet of people, you need to wear a mask. the gatherings that the county is discouraging right now are designed to make sure that there's no spread of the virus. As we get this under control, small gatherings of people that just 5 people, 6, a couple of families together, not a huge social party, but just, someone over for a barbecue. My guess is that those things will be permitted and perhaps encouraged. And the question is, will you have to wear a mask when you go over to your neighbors for a barbecue? And so right now, the masks are sort of recommended, are mandated. Mm-hmm. But as the numbers drop, if you know these people and you know that they're asymptomatic, then the masks may not be necessary. So as I look into my crystal ball, I think 4 to 5 weeks for small gatherings of friends, not strangers, but people that you know and trust. I think the mask will be no longer required. But that all depends on this testing and tracing. Mm-hmm. And if the risk of you and another family getting together is infinitesimally small, that you will pick up coronavirus, because they're doing this all to protect you, Sally. We're not punishing you. We're trying to protect you. Then I think these restrictions will lift.
I'll get to the symptoms, because this was my biggest question that I still come back every single time, and asymptomatic and all of this in a moment. But I did ask you about the pools.
Yes.
And I had a few moms reach out to me and say, especially because we know drowning in children is a huge deal. And parents a lot of time rely on swim lessons for their kids and pool safety and having the kids in the pool again. How do you think that's going to play out this summer?
So when we talked about that, the chlorinated pools should be fine. Okay. You should not get coronavirus from swimming in a coronavirus pool, even if someone with coronavirus was in the pool previously. It's those little lawn pools where you take your hose and you fill it up and it's just fresh water. I'm not aware of studies where people have actually looked at the viability of the coronavirus in fresh water. And when kids are playing in pools, they get water everywhere and they're swallowing it in their eyes and nose. So the little kiddie pools I worry about. But if you've got a chlorinated pool and you test it and the chlorine is fine, coronavirus should not be a risk for you swimming in that pool.
But if you're in the pool playing, or you have a swim instructor, a coach teaching swim lessons, that still could be problematic if we don't know if the coach has coronavirus, because it's close contact.
So that's a good point. And that goes along with the whole mask thing. We're so close to getting this under control. Mm-hmm. That my guess is that the coach will be wearing a mask as he stands at the side of the pool teaching the kids, and the kids will be 6 feet from each other. I don't think anyone's going to make a child wear a mask in the pool, but I suspect that the coach will probably need to wear a mask until we have things better under control.
Let's talk about this asymptomatic. Every day I turn on the TV, I know what Dr. Bradley said. Why is this telling me that 25% of the reason that this is spreading everywhere are from people who don't know that they have it, and they're silent spreaders?
So back to what I've been saying all along. If you're sick, you feel sick. You're symptomatic. If you don't feel sick, you are considered asymptomatic, even if you have a little bit of a scratchy throat or an itchy nose, or eyes that itch. So asymptomatic, to me as a doctor, is complete lack of any symptoms at all. Whereas in the press, asymptomatic is someone who's not overtly sick. So it's true, and there's plenty of evidence that you can be shedding virus before you get sick, pre-symptomatic. You can be shedding virus after you get sick. So if you didn't get tested and you had this bad flu-like illness, and then the next day go out with friends, you can probably still be contagious for 3 to 5 days, maybe up to a week. We haven't defined that yet. So people who aren't sick can spread it. But in order to say asymptomatic from the medical standpoint, I would need to say this person was in contact with someone with coronavirus, and that you track that person every day, and that you tested them every day, and you asked them for a complete list of symptoms, including mild symptoms, every day, and then you could see that they started to get a little bit of virus when they still felt well but had a few symptoms, and then they got sick, and then after they got over it and they felt well enough to go back out and do stuff, but they still might be contagious. So the asymptomatic ends of the spectrum, but before and after you get sick, are indeed ways to spread this virus. What I don't know, and we keep talking about this, is someone who's exposed and is medically evaluated every day as well as tested every day to show that someone has absolutely no symptoms, and is able to have culturable, spreadable virus, from their nasal pharyngeal swab. So, and I keep looking for those data in the literature.
And you haven't seen it?
Have not yet. I've got, it might happen. There are virtually no viruses that we know of, respiratory viruses, that do that. And Dr. Anthony Fauci has said that many times. So this respiratory virus might be the first one we've ever discovered that can cause an infection that spreads without someone being symptomatic at all. And that would be incredible. And whoever does that study and publishes that paper, that's going to be a huge advance in our understanding of this virus.
It will, and I think probably just for the normal person, average person who doesn't have all the knowledge in the medical, that's probably one of the scariest things is you can look at somebody and they look great, they're behaving great, their energy is great, but you're scared of, do you have it? Do you not have it?
Right.
And that's probably the most frightening thing for many.
Right. And I will absolutely acknowledge that there are people out there who feel fine and are spreading. They just aren't sharing with you their minimal symptoms, which they pass off as nothing. We all have little symptoms, that we pass off as nothing. But if you've got coronavirus, those little symptoms may mean something very important.
If you are even shedding the virus and you are in that stage, if you are wearing this mask and you are around people at 6 feet, could you be passing the virus?
No, that's the whole idea. The mask prevents you from spreading this virus to other people. The primary reason for wearing the mask for everyone is to prevent those people from spreading virus to other people. If you cough or you sneeze, you won't spread it to anyone. If you talk loudly, if you sing with a mask on, and you have coronavirus, you will not spread it to people around you. The facial coverings are less effective at preventing you from getting infected because they're much more porous than surgical masks. But they work really well to contain virus that you have that you could spread to other people.
So based on what you say, I wear a mask, facial covering. I wash my hands. I don't touch my nose, my face. I'm going to be okay. You're
going to be okay. Absolutely. And I'm telling you the truth as I understand it, and I'm not even a qualification, Shali. If you wear your mask and you wash your hands and you don't go around sick people, hopefully sick people aren't out there walking on the streets. But if you avoid sick people, you should be fine.
I had a mom message me and ask me if there was any truth to a rash.
A rash might be a symptom. What we know is that you can have coronavirus, which causes those mild respiratory symptoms and then bad flu-like symptoms and difficulty breathing. And then there's all the other diseases that people would get if coronavirus was not there. People get rashes, right? People get fevers. People get bacterial infections. And so if you have both together, if you happen to pick up coronavirus while you've got a bacterial infection, then someone will say, oh my goodness, the coronavirus is causing this bacterial infection. Our minds normally work that way. But it's what we say, it's true, and unrelated. So one doesn't cause the other. You just happen to be unlucky to get both at the same time. So the virus may have inoculated, was on the mucous membranes, and it can stay there for, 6, 12 hours. And someone picked it up by the NP swab, but a productive infection of cells that generated immune response never happened. And so these are preliminary data that are coming out, and I don't know how to interpret that. And maybe the blood test they used was a really bad one, and they were really infected. You just didn't pick it up. And there's always a certain percent of people who don't produce antibody, but the lymphocytes that kill the virus, those are still working. So it may be that the antibody test, the serology test, won't pick up a certain percent, and actually they were infected and they have an immune response. But there's a question now about does everyone who has a positive PCR actually have a true infection? And are you actually contagious to people?
Oh.
So these data have just come out over the past few weeks, so I don't want to confuse people.
Sure.
I want them to think that if it's PCR positive, it's the real thing.
Right.
But I want you to know that in these very low inoculum states, and maybe someone contact tracing, if you do PCR on everyone, some of these people who got inoculated don't have a true infection. The virus won't actually take hold.
Wow. That would be a game changer too.
It would be. It would be. And public health isn't going to share that until it's proven because they don't want people thinking, oh, positive PCR, I'm not contagious.
So this mask, Dr. Bradley, is like everything right now.
It's huge. It's a huge inconvenience. And when I go into the room of a child, I like to connect with them and smile at them and sit down on the at the edge of the bed and chat with them. And now I'm going in, with my mask and all of this, and I have trouble connecting with them. And I'm sure they're scared of me. So I don't want to use the masks as soon as we don't need to. But you're absolutely right. At this point in time, we've got this virus under control, and if we keep the masks on and we stop the spread, and then there's only a few cases here and there, and the county can handle that, we'll be golden. But the masks are important now.
Speaking of the mask, because I was out and about myself this weekend, and I saw a lot of people wearing their mask, just covering their mouth, and their nose was hanging out, and I paused for a moment. I'm like, what are you doing? Isn't this supposed to be, is there a right and wrong way to wear this mask?
Your respiratory mucous membranes that are infected with this virus includes the nose. That's where we do the test. And if you sneeze, even though these famous pictures of all of the stuff coming out of your mouth, there's stuff coming out of your nose. It's pretty gross, but it's a very efficient way to spread viruses. So you need to put the mask over your nose, and when you sneeze, you should sneeze into the mask. Don't take your mask off and sneeze. You've got a mask to contain that sneeze. And then, of course, once you've sneezed, get a new mask, put that away, wash your hands, put on your new mask, and you're good to go again.
Before we get back to COVID toes, because that's where we left off, I did have another question, and you may or may not know this, but the delay in hair salons and nail services and et cetera and all the gyms, if you are wearing a mask, but you're still close to someone. I know that there are a lot of people that are really bothered about this, that the governor said that we're months away from those businesses reopening. Why?
So there's two answers to the question. I always have two answers.
I like two answers. I like the more, give me more information.
There's the public health answer, and then there's the science answer, and they're connected. So the public health answer is when the more close contact you have between people, the more likely people are going to spread. And just as you point out, they'll wear masks that don't cover the nose. And maybe in your, where you get your hair done, someone goes, I just can't breathe, I'm just going to wear them. And that hairdresser is putting you at risk. And in public health policy, we know if your hairdresser is not going to be doing your hair 6 feet away from you, they'll be right next to you, and they sneeze, and they aren't covered, you're going to get infected. And so the health department knows this. This is part human nature. And we trust people to a certain extent, and then there's just ways that people bend the rules all the time. We're all humans. And so the governor's trying to get this under control. So a event where you are, by definition, very close to someone puts you at risk, and if you had coronavirus and you weren't wearing your mask, your poor hairdresser is being put at risk from you. So from the public health standpoint, until the virus has stopped circulating in the community, they're not going to lift that restriction. Now, in a perfect world, if your hairdresser was screened like we are, and no fever, no symptoms, temperatures taken, and that's required to go into a salon, and your person wears a mask, you wear a mask, then technically you should be protected because you have low-risk people who are not likely to be spreading, and you have the extra protection of the masks. But I can't sit here and say, well, in a perfect world it will work, and say everyone should open up. That would be irresponsible of me. And so I understand where the governor's coming from, but it's not that there's some secret way that the virus will spread. It's my belief is that it's human behavior, and the job of public health is to protect you, not to punish you. And once the virus stops circulating, then we can let up all of these draconian measures.
But even if the virus stops circulating, as we start to reintroduce schools again,
Yep.
and you'll blink and it's going to be Christmas and the flu season,
Yep.
and the cold weather,
Yep.
then I can only imagine that the numbers will.
Yes, but we'll be ready with testing capacity. I mean, the county's got like drive-up mobiles now that they're going to the different neighborhoods. They're really doing a nice job. All the healthcare systems now have testing capacity. A month ago, it was dire. We could only test. You remember this? 10 kids a day. Mm-hmm. Everyone else we couldn't test. So now we can test hundreds. Technically, between 500 and 1,000 a day, we have the capacity if we need it. So in the fall, with all this testing capacity, we'll be ready for the virus if and when, probably when, it starts to circulate. And then all these social distancing measures will be put back in place in order to protect the population. But we'll be ahead of the curve this time. I think we won't be playing catch up.
Back to the COVID toes is where we had left off.
Yes.
So you were explaining
Yes.
about that and what happened.
So there's diseases that people get normally, rashes, infections, and such. And then people are getting coronavirus because they're being exposed to friends and neighbors and colleagues and strangers. And you can have a rash and you can have coronavirus, but they aren't necessarily the same. COVID toes has caught the imagination of everybody. And as I mentioned, our dermatologists are very engaged in trying to track this down, what causes it. And now that we have the blood test to see if someone's been infected, if you've got COVID toes, which generally occurs late in the illness when the blood test is pretty accurate, we're now testing them. All these kids with presumed COVID toes are now coming to get the blood test. And of 14 kids that we've tested, none of them have turned out to be positive. So yes, there are toes that are causing a rash. One of them actually even got a biopsy. Someone took a little piece of tissue and sent it off to the pathologist, and it's not a vasculitis, which is what we worry that coronavirus would cause. So what are all of these people doing at home with social distancing that's giving them rashes on their toes? That's the question. But it's probably not coronavirus that's actually causing it. And there's associations with all kinds of other infections, with seizures, with Kawasaki disease, with toxic shock. I can go on and on and on.
Because you can still get sick and not have the coronavirus. I think we've talked about that many times here.
Yes.
Many times. I can't even tell you how many times I take my kids to the doctor, 4 of them, and it circulates. We get sick. All the time. So
we do. And bacterial infections still cause problems. Even with social distancing, the staph bacteria that are already on you can invade. Strep bacteria can invade. Babies can get meningitis, so the babies need the vaccines. So all the bacterial infections are still happening, unfortunately.
That would bring me to my next question. I had a few moms message me and ask me about traveling with their kids and whether we can even do that in 2020, or do we scrap all travel plans until further notice?
So there's travel in a plane, and is that dangerous? And I know all the airlines are taking this very seriously, and one of the airlines is now providing masks, making masks mandatory, and if you don't bring a facial covering mask with you at the boarding gate, they will give you one. Mm-hmm. And they have all these procedures for wiping down everything, more distance between the seats. Someone even told me they're going to arrange how the seats are so that people aren't next to one another. So I think travel in a plane is actually going to be safe. It's where you're going to. So if you're planning on going to Disney World in Orlando, I don't think that trip's going to happen soon. It'll probably open this fall on a very limited basis, like Disneyland will, and we've talked about that. But I think travel plans depend on where you're going. These big concerts and plays, and one Make-A-Wish kid wanted to go to a Broadway play, and it's like, I don't think they're going to put on plays for a long time until the vaccine comes out. So these the Make-A-Wish, many of the Make-A-Wish families have these wonderful plans. Some of them want to go on ocean cruises.
Carnival Cruises announced they're going to reopen as of August.
Oh my goodness. Well, I'm not going to go on a cruise.
I'm not going on a cruise either right now, Dr. Bradley.
Haven't been on one and don't plan on going soon.
One final question, if there's anything else that you'd like to add, as we start to see the opening up of our cities and our areas, what is the biggest advice that you can give parents and families and people listening right now just to protect themselves, not to be fearful, but how do you protect yourself and your 3 or 4 children? If you want to go out, you're going to go shopping, you might go to the beach, you're going to go to a neighbor's house at some point when they start to allow this. What do you do?
So I think the most important thing is keep track of your kids. And it was always tough to keep track of the youngest of my 3 kids. She was always off somewhere. But you need to keep track of them so that if you're at a store, the malls will open up soon. And And if you just go with them, and probably masks for many months will be part of our future. But if they all wear the masks and you make sure, and of course if mom and dad wear masks, the kids just assume this is normal behavior, you can then get out and you can be safer. And if everyone around you is wearing a mask, then they're not going to infect you. And the whole hand gel, take your hand gel with you, because as you go out and you start touching tables and doorknobs and buzzers and all that stuff, every time you touch a foreign surface, it's possible that someone with coronavirus has touched that before you. And so if you have your mask, at least you're not going to, rub your nose. But make sure you gel your hands frequently when you're out and after you touch stuff. So that's I think the most important thing is just keep track of where your kids are, wear the masks, and make sure that you've got gel. And there are a lot of companies that are making gel now. Even one of our breweries is making gel. So thank goodness for ingenuity of people in San Diego.
Anything else you'd like to add? Tell me anything new, anything that would be...
There was one, just the test, trace, and treat. So the next thing I'm looking for, and you can look for this, is the fact that the test, trace, and treat approach is going to be effective at really decreasing the number of new cases that are out there. So that's the first thing. Second thing is we've got remdesivir. So I know that there's pressure on Gilead Pharmaceuticals to make the drug available on FDA emergency use authorization. So pretty soon, if not already, and I don't know if there's a drug supply issue. I know the company's been hoping to market this, but pretty soon, if anyone actually gets this and is in the hospital, gets coronavirus, that they should have treatment with remdesivir available for them. So a week or two ago, it's like, no treatment, you have to be in a trial, don't take stuff off the counter, no disinfectants. Now we've got a drug which has gone through all the clinical trials, and it looks like it works. It's not like a miracle where like penicillin for strep throat, where the next day you feel fine. But it shortens the duration of illness. You get out of the hospital sooner, and we're hoping if it gets started early that we can prevent lots of deaths. So, and there's many other drugs that are in clinical trials. So remdesivir is just the first one. So that's a wonderful advance in this whole pandemic. We have treatment now.
This is the best interview I've done with some really, really good news since we started doing this. Dr. Bradley, thank you.
Thanks so much, Sally.
You've been listening to It Is What It Is with Shali Zomarodi. You can join in and ask your questions live on Shali's Facebook or Instagram page. You can find so much more by following Shali on Facebook, Instagram, Twitter, YouTube, and by visiting shalD.com.